They said it couldn't be done. It wouldn't be possible to fix our broken healthcare system. It wouldn't be possible to practice medicine the way it's supposed to be practiced. It wouldn't be possible to lower the cost of healthcare and make it affordable for people in our communities. But here we are, 1,000 doctors strong, and we're practicing medicine on our own terms. We're becoming the physicians that we were meant to be. And our movement is growing, building momentum day by day. People choose direct care because they have access to wholesale medications, at-cost labs, and at-cost imaging services. People choose direct care because they can build a relationship with their doctor. People choose direct care. Sorry, I'm losing the signal on this.
It's a nice map.
Yeah. I don't think this advancing slide is working. I don't know if I have to point in a certain direction. I'll try this again. People choose direct care because they have access to wholesale medications, at-cost labs, and at-cost imaging services. People choose direct care because they can build a relationship with their doctor. And people choose direct care because they believe what we believe, that healthcare should be affordable and accessible for everyone. My name is Dr. Paul Thomas, and I was invited here today to share my vision about what it means to be a family doctor. I also want to inspire you to become the doctor you were meant to be. To get there, I want to share this concept of Ikigai. It means your reason for being. I'm guessing that many of you are good at what you do. We have plenty of wonderful, empathetic physicians in this audience who are excellent doctors, right? And a lot of times you're limited by the system that you work in. So it's great doctors often in a bad system. I'm guessing that you get paid for what you do, right? Many of us went into this profession because there are so many benefits to being a physician. One of those is in the system, there's a good amount of money to be made. And oftentimes we're providing what the world needs, maybe. Sometimes it doesn't feel that way because we have such a limited amount of time with our patients. But I'm guessing that you're here because you're in search of something greater, something that you can't quite put your finger on, and that might be your Ikigai, or your reason for being. And I believe that when you understand this concept, it can help guide you to a purposeful and fulfilling practice of medicine. So from here on, I'm going to talk about the character traits that I've witnessed in my colleagues when I look around this room, who have the most successful direct primary care practices, who are the most successful DPC docs. And we'll start with our purpose or mission. So going back here, part of this is purpose or mission. So I'm going to focus on this because I feel like it's really important. Knowing what your mission is. For me, I've always wanted to be a family doctor. And that's a lie. I actually wanted to be a Ninja Turtle growing up. And when I realized I wasn't an amphibian, I had to come up with an alternative career plan. And so I started volunteering at a clinic near my house in one of the poorest neighborhoods in Detroit. I was working with medical students at Wayne State and taking care of the most vulnerable patients in our city. And we were supervised by a family doctor, and I was always impressed by his skill, his ability to take care of the most challenging cases. And I wanted to be like that when I grew up. I wanted to have that level of skill. And in medical school, I became acutely aware of the lack of primary care resources in my city. There are fewer than 100 primary care physicians for 630,000 residents. That means there's one doctor for every 6,300 residents in the city of Detroit. And so all these areas, these pink areas on this map, are underserved regions of the city. So virtually all of Detroit. And the irony is if you go north of 8 Mile, or just to the north of Detroit, out of Wayne County into Oakland County, they have one primary care physician for every 600 residents. So it's a 10x disparity just across 1 mile road. Because of this, my classmates and I built an outdoor medical clinic. We were going to solve the healthcare crisis. For us, it poignantly represented the healthcare disparities in the city and our idealistic hope to solve them. I went into medicine wanting to help people and to serve others, and I wanted to address these health inequalities, and I wanted to make a difference for my patients. So for me, that's my purpose, that's my mission, that's why I'm here. But the further and further I got in my training, the less and less time I was able to spend with my patients. And you all know what this feels like, right? It's probably why you're here too, right? You want to know how you can actually take care of your patients. Being a primary care doctor is like trying to catch sand, with each grain representing a patient concern. There are only so many concerns that we can take care of before problems start slipping through our fingers. And that might be your mom's Alzheimer's, or your brother's chest pain, or your daughter's sore throat. And when your patient panel is at 2,500 or 3,000 patients, those are a lot of grains of sand that are slipping through our fingers. So prescriptions go unfilled, screening tests are missed, and in many cases, the basic healthcare needs of our patients go unmet. Worse still, as was mentioned previously, doctors are feeling burnt out and wanting to leave the profession. A recent study from the Mayo Clinic confirmed what was said earlier. 54% of physicians are feeling that burnout. And I was burnt out, and I hadn't even finished residency yet. Like, I wanted out so bad, I can't even tell you. I was worried that I'd be trapped in a system that undervalues primary care, that undervalues human relationships. I was worried that I would be trapped in a profession that was slowly losing its soul. Which brings us to our second topic, passion. So, doing what you love. I knew that I would never be satisfied by checking boxes in an EMR or fulfilling the quality metric of the day. I wouldn't be satisfied by practicing medicine in a system that gives me only 8 to 12 minutes with my patients. I knew that if I were to build a fulfilling practice and a fulfilling life for myself, it would have to focus on my passion of serving others. You see, I was most fulfilled at that clinic for homeless folks and underserved folks in my neighborhood. 30 minutes to an hour with these patients, really understanding who they were, what their concerns were, and how we could best help them to the next step in their lives, making a tangible difference for them. That's what turns me on about being a doctor. That's my passion. I also knew it was important for me to have an impact beyond the individual patient. I wanted to serve a community that was left behind by the traditional medical system. And I kind of mentioned this before, but in a different context, a lot of the healthcare systems choose to locate their offices and hospitals in the wealthiest neighborhoods, right? Because they make the most reimbursement when they have the wealthiest patients. And this is a map from the city of Detroit, health professional shortage areas, those HPSAs. And there are virtually no hospitals or branded, large health system outpatient clinics. So even if I wanted to sign on as an employed doctor, I wouldn't be able to be in the neighborhood that I wanted to serve. This often leaves the poorest neighborhoods medically underserved, and in Detroit, where residents lack access to reliable transportation, healthcare becomes geographically out of reach. So this is my passion. This is why I serve and why I solve these health challenges. This is why it's important for you to find your passion. Starting a direct primary care practice has been the most challenging, but also the most rewarding thing that I have ever taken on. And for you, it will require a tremendous amount of time, energy, effort. So if you're working on something that you're not really passionate about, you're not going to reach that sense of fulfillment, that reason for being, that ikigai that I mentioned earlier. The next step in being the doctor you were meant to be is to be authentic and practice with authenticity. This movement is made up of individuals doctors who have their own strengths and weaknesses, their own personalities and characteristics. Some of us have built our own electronic medical record just for the purpose of taking care of patients, with an emphasis on taking care of patients. So thank you, Josh, man. Some of us have started some sort of healthcare co-op. I keep hearing about this on Hannity.
2019.
Yeah. Oh boy. And And some of us have spent 20 years working on direct primary care over the last 8 years. You're aging well. You're aging well, my friend. Some of us have learned second and third languages in order to better communicate with the patients that we serve. I tip my hat to people like Rebecca, who have learned Spanish and who are now actively learning Portuguese to do just that, take care of her patients. It's amazing. Some of us give rousing speeches to open conferences. This is never going to die. And lose their shirts in the process. You know who you are, Jeff Gold. Salveo, hashtag Salveo. So my message is to be authentic and understand your strengths and weaknesses. When you're working under one of those large healthcare systems, the personality of the doctor is often discarded. Like he said in his presentation before, you're often labeled as a provider. You're not even to be a doctor. You're intentionally confused with someone else with another professional title. You become this replaceable cog in the machine of the healthcare industrial complex. But you're not a cog. You're an irreplaceable, dynamic, complex, empathetic, loving, and caring physician. You're my colleague. Because you are a DPC doc, you can embrace the unique aspects of your personality that make you a great physician, that will allow you to practice medicine the way you want to practice medicine and not the way you're dictated to practice medicine. Be authentic, be you, and your patients will be drawn to your unique personality and your unique practice. Next, care. That's it. Care deeply for your patients. I don't think I can overstate this, the importance of demonstrating genuine care for your patients. But if you want to become the doctor you were meant to be, you now have the time to demonstrate that care. I'm going to repeat this. I'm going to say it normally, and then I'm going to use my movie voice. In a world where patients are rushed through appointments, treated as the number on the back of their insurance card, and given the opportunity to ask only one question of their physician, you can stand out boldly by doing one thing, and that is caring. So you ready for this? In a world where patients are rushed through appointments, treated as, no, you get it, coming this fall. So what does that look like? It looks like meeting your patients at the door or in the parking lot and shaking their hands on their way into your office. Who does that? Direct primary care doctors do. It looks like taking the time to explain what it means to have diabetes and how to best take the medications and how to manage it completely. It looks like taking the time to actually get to know your patients, know their personal lives and how they're feeling in the context of a new diagnosis. It looks like going the extra mile and getting that lab test or medication or imaging study that was previously out of reach for them. And here's a fun one. It looks like coming in the middle of the night sometimes and being the hero, right? So I was at this event, gala, 150-year celebration for Wayne State University School of Medicine. And I was in a tux, black tie, and one of my patients had cut off the tip of their finger, and they were profusely bleeding. I got a call at 10:30 that evening, and they said, it's a restaurant that signed up with our practice, and they said, one of our employees cut the tip of their finger off. And I said, I'll be there in 20 minutes. And it really only took 10 minutes of my time and some Drysol applied gently to the tip of the finger, and it stopped bleeding. They were so happy. And they also brought sake and dumplings because I work at a restaurant, and my wife was thrilled. She was like, this is the best thing ever. It's amazing. It looks like following up with them via text message and asking them how they're doing after they left your office. So this is a true story. We were on Channel 7 Action News in the Detroit market, and they said, oh yeah, just have a normal text conversation with your patient. And I sent her a text message that's not awkward at all that says, tell me more about the thing. That's normal. That made it on air. Oh boy. And the best part about all of this, about caring deeply for your patients, is that it comes naturally to you. You're a doctor because you actually care about people. You have this deep-seated trait for caring for people, and it's probably one of the biggest reasons why you chose a career in medicine. And now in this model, as a DPC doc, you actually have the time to demonstrate your care without restriction and without limitation. So we've talked about purpose, we've talked about passion, we've talked about authenticity and caring. These are all the things that can help you get to that doctor you were meant to be, that Ikigai, if you will. Now I'm going to challenge you on one point. I want you to tell your story and communicate your value. What this movement needs now, more than ever, is to communicate the value of having a doctor who is looking out for the best interest of the patient. We as physicians know our value. We know how good we are and how caring we can be when given enough time and space. When we no longer are restricted by health bureaucracy or insurance red tape, we can deliver the sort of care that we can be proud of. And there are thousands of physicians across the country doing this every day, and so many amazing stories that we can tell. Because patients are craving this sort of value that our practices provide, when they hear the message from the individual physicians in their community, it resonates and our movement grows. When they hear the message from NBC News, it resonates and our movement grows. When they see us on Sean Hannity, the message resonates and our movement grows, including the bodyguard. When they hear the message on National Public Radio or they see us on Medscape, the message resonates and our movement grows. So here's my challenge. What stories can you tell? What are the stories that are going to resonate in your community? And oftentimes it might not be from you, it might be from your patients. Those are always the most powerful. How can you communicate your value and tell the story of your impact? Because we need you. For this movement to grow, we need you to lean into storytelling about your patients and what you do for them. What it means to have an empathetic and caring physician with the resources and time to make a big difference. So I think this was Jay-Z who said, no, it's Seneca. Luck is what happens when preparation meets opportunity. The more you get out and speak in your community, it might start at the Rotary Club, but you might meet somebody in broadcasting and they might invite you to be on the nightly news or on the radio. It might start there, but I believe that somebody in this room is going to make it big for us. They're going to be the next person on NBC Nightly News or on Good Morning America with Michael Strahan. Or, my favorite, you're going to dance onto the Ellen set and you're going to sit in the white chair across from Ellen. You're going to tell her about the value that we provide to our communities as physicians. And Ellen, if you're watching, if your staffers are watching, I've been working on my dance moves. I'm ready. So in summary, direct primary care gives you the opportunity to practice with passion and purpose. It allows you to be your authentic self and give the time and demonstrate the care for your patients. It is the most unique opportunity that we have in primary care medicine, and if done right, you can find your Ikigai, or your reason for being. I believe in family medicine. I believe in primary care. I believe in the direct primary care movement, and I believe in you, the doctors in this room who are fixing our broken healthcare system from the ground up. You can be the doctor that you were meant to be, and it starts today. One day or day one, you decide. Thank you.